Mark, how has the kinetic control process evolved recently, and what can therapists expect to gain from coming on your courses?
The kinetic control process has been continually evolving and is reflected by clinical practice, current research and the best evidence available that we can find. There's been a general consensus by therapists attending conferences over the last 2 years that there's a problem managing musculoskeletal pain. This doesn't seem to be new. However, there is some good news. The current systematic reviews provide evidence that many therapies are effective in managing pain in the current episode. And this includes exercise therapies such as those that we teach in our kinetic control courses. The bad news, however, is that in trying to manage musculoskeletal pain that is recurrent or pain that produces chronic disability doesn't seem to have the same clinical success in the systematic reviews. Our kinetic control courses attempt to address this problem. We teach people to identify and subgroup uncontrolled movement and make links between the site and the direction of uncontrolled movement and musculoskeletal pain and movement control deficiencies. Our courses produce clinical guidelines to prioritise whether we should start with global stabiliser muscle training to control direction-specific provocation of movement, or to start with local muscle retraining to control intersegmental translation. The research over the last 5 years has given us some good information on dealing with recurrence and chronicity. There have been strong links between submaximal testing, that is testing using non-fatiguing loads, and identifying consistent and predictable changes in the patterns of muscle activation and the thresholds of activation between muscles that have a stabiliser role and muscles that have a mobiliser role. These aberrant patterns have been strongly correlated to recurrence. Our courses present options to identify and correct these aberrant movement patterns. So currently, the kinetic control courses are clinical reasoning at its best in relation to contemporary physiotherapy practice.